Hello, I'm Dr. Manoj Bhatawdekar. I'm a psychiatrist. Today, we have a guest speaker with us, Dr. Anjali Joshi, who's a pediatric occupational therapist who specialized in sensory integration, and she's an ex-professor of OT School and Center of GS Medical College and KEM Hospital. If you remember, we have spoken earlier about two disorders of childhood which can be detected in preschool years, namely attention deficit hyperactivity disorder or ADHD and autism spectrum disorder or ASD. And we had talked about the role of an occupational therapist in the management of both these conditions. So today, Dr. Anjali Joshi will enlighten us about the role of an occupational therapist in the management of these two disorders.
Hello. Before I tell you about the role of occupational therapist in ADHD or in ASD, let me tell you what is occupational therapy all about. Occupational therapy is a science of rehabilitation. And what an occupational therapist does is it works towards the well-being, physical and or mental well-being of a person who has dysfunctions or disabilities. Now, with this, now let's understand what are the manifestations of ASD and ADHD. Now, in these children, typically the delays are related to cognitive skills, social skills, communication, attention, concentration, play, and functional skills. So, across all these areas, occupational therapist plays a role in mitigating their dysfunctions and challenges. So let's now see how would these dysfunctions manifest. Typically, a child with ASD, say a 2-year-old little boy with ASD, would have difficulty relating to people around him, would have difficulty communicating with people. He would have his own agenda. He will move around, but he will not be able to point or talk to people. He would have difficulty tolerating certain textures, smells. Now, this is something which is completely a new area that I'm introducing here. Other than, or besides these other dysfunctions that I mentioned earlier, there is an area called sensory. Now, what is sensory all about? See, we understand the world around us, we perceive the world around us through our senses. All of us are familiar with our 5 senses: the sense of smell, the sense of taste, sense of hearing, vision, and touch. Now, besides these 5 senses, there are 3 other senses which play a very key role in our understanding of the world around us. And those 3 senses are the vestibular sense, or something that is part of our inner ear, proprioceptive sense or a joint sense, which means the sense which helps us to understand how to hold an object in our hand, how strong our grip should be, or how light our grip should be. And the third sense is an interoceptor sense. What do we mean by interoceptor? Interoceptor is responsible for us to recognize our hunger, sleep, need to use the bathroom. Now, this particular sense also plays a very crucial role in how we function effectively and how we cope with the environment. Now, what happens in children with ASD, ADHD, and similar developmental disabilities is they have difficulty processing these sensory information. The messages that go through these senses to the brain and the messages that come back from the brain, there's some communication difficulty there, and that is why children with these dysfunctions often have either they are hyper responsive or they respond excessively to the inputs that are coming in, or they could be sometimes hypo or under responsive, which means a simple sense of touch by the mother, the child may feel it's as if it's somebody slapping him. At the same time, little bit of pressure that's required to open a tiffin, this child will not be able to use that much of force and will come back home from school without opening his tiffin. So these kind of multiple issues, the sensory dysfunctions, are something which create a extremely difficult for a child to cope up with his environment. So, for example, if you constantly need a sense of movement, or say, for example, you're not able to take in the dal chawal that your mother is feeding you, or you're not able to tolerate brushing, how difficult the life would be. And how difficult the life would be not only for the child, but also for his caregivers or parents. So these sensory dysfunctions play a crucial role, and an occupational therapist is equipped to work with the family to help this child overcome these sensory dysfunctions. So it could be therapy which is specifically for these dysfunctions, which is called a technique called sensory integration therapy technique, and or modifications which are required in the environment so that this child will be able to overcome these dysfunctions. So broadly, if we look at it, an occupational therapist is going to work on sensory, cognitive, attention and concentration related difficulties, physical or motor dysfunctions. Now, what motor dysfunctions these children could have? They're not like children with cerebral palsy who are not able to walk. These children can walk, run, etc. But they would often have difficulty with fine motor skills, as we call it, which means the child may have difficulty, say, picking up small objects. The child might be very clumsy and he may tend to drop things very often. So this is another area. And most importantly, the area of social and communication skills and play. ADHD and ASD children have different kind of play and engagement with other people. And that's an area an occupational therapist can work towards, which helps this child to enhance his other developmental skills and also facilitate his learning. So now with these different kind of dysfunctions, a child with ASD or ADHD is referred to an occupational therapist by the doctor who has assessed this child in the first place. Now what we do is we'll use our assessment modalities. They could be formal tests or informal tests to understand how these dysfunctions are affecting the child's daily life, because that's very important. Functionally, how is it impacting the child? So that becomes the part of assessment. Based on that, then we plan our intervention strategies. The key thing in the intervention strategies is training the parents how to work with this child during those next 23 hours that the mother or the parents are with a child, because this child will come for a therapy, say once a week, twice a week, if the child is fortunate. And the reason I'm saying is, if there are so many therapists available, the child may come 4 or 5 times in a week. But rest of the times, the parents are the ones who are going to be the child's therapist and the guide. And that training is something an occupational therapist is going to offer to the parents. Now, having said that, I think one must remember that occupational therapist is not going to cure autism. What a therapist is going to do is the dysfunctions which are occurring because of autism, the therapist is going to use her techniques, her modalities to minimize the dysfunctions or minimize the impact of those challenges, so that this child is able to perform optimally and function effectively in the environment. Which means this is going to be a long process. The child's demands are going to change over a period of time. So a little baby will have a different kind of demands and needs. As the child grows and becomes older and goes to a nursery school or a pre-primary school, the demands are going to change. And of course, the demands are going to change as the child starts going to higher classes or to college or starts working. Based on the demands and the requirements, the therapist is going to change her program, which means the child may require in the initial phases continuous ongoing support from a therapist. Over a period of time, that support will change. It may take into a form of, say, consultative therapies once in a while, touch base with the therapist once in a while. But that kind of a support might be required for a long period of time. So this child with ASD is going to require therapeutic interventions right from the day the child is diagnosed. So starting from early infancy stage to going to a pre-primary school or higher classes, the needs are going to change and accordingly the therapy is going to change. Which means the parents will have to be in constant contact. Maybe the frequency will change, but constant contact with the therapist who's going to help the child learn how to overcome the dysfunctions. So, having said that, which also means an occupational therapist is not going to cure autism. What she's going to do is teach the family and the child how to cope with the manifestations of that particular condition.